30 years ago, I was a homemaker and mother and planned to do that for the rest of my life. However, my daughter had chronic bladder infections, and the doctor that was treating her actually put her on 2 psychiatric drugs for their side effects on the bladder. And while I questioned it and wondered why he would do that, his explanation was simply, she has to do this, you have to do this, or she's never going to get well. So as a young mother who, didn't know any better and not a physician, and trusting that doctor, I put her on the psychiatric drugs. It was Valium and Tofranil, which is an antidepressant. Well, not long after that, she was on them maybe close to 6 months, and I had noticed when she missed a dose, she had some strange behaviors, and this was not a child who had any behavior problems. When I mentioned this to the doctor, he just said, well, just stop the drugs. And he implied, just stop them cold turkey. And I did, and sent my child into a downspin that she really did not recover from for 3 years. And she became really deathly ill. And in my search to get her well, I went to many, many doctors, and finally found a doctor who called himself a medical detective, who really tried to find the underlying cause of the problem and fix it rather than just throw drugs at side effects, at symptoms. So this doctor impressed me so much. Not only did he help me get my daughter well, but I decided right then and there at the age of 39 to go to medical school myself to protect my family. And I felt like as a mother it was my job to do that, because if I didn't understand what doctors knew or didn't know, then something like this could happen to someone I loved again. And so at 39 I started medical school. And it was quite an experience going in to school with the perspective that I now had after what had happened to my daughter. I guess you could say I was a little cynical when we were taught so much about drugs and prescribing drugs, and I began to see the influence of the pharmaceutical companies on the students, on the doctors that were teaching us, and literally from then on in our medical careers, I saw this huge impact that the pharmaceutical companies had. Fortunately, my daughter got well, and as I started my practice, unfortunately, my mother was diagnosed with terminal lung cancer. And knowing now that medicine didn't have all the answers, I researched, and she received both conventional chemo and radiation, but also unconventional nutritional therapies and visualizations and hypnosis. And instead of being dead in 2 months, as was predicted, she was cured in 4 and lived 18 more years completely free of cancer. So I feel very fortunate to have gone to medical school and learned what doctors know and also what doctors don't know. As I got and opened my medical practice, I began seeing all these children being diagnosed and labeled as ADHD. And this was the early 90s, and this was the kind of when ADHD diagnosis really just exploded. The diagnosis had been accepted as the Americans for Disabilities Act accepted it as a real diagnosis at this point. So we began seeing literally millions of children being labeled ADHD and put on drugs like Ritalin. And so in my earlier experience with my daughter, I realized nobody was really looking for the cause of those symptoms, and they were just treating the symptoms. So I began focusing my practice on this ADHD population, working on finding the cause and fixing the problem, and had a great deal of success with that, and still do. As time went on, though, I discovered that almost all of the mothers of these children who had been labeled ADHD were taking antidepressants. And as I queried them about, why are you on the antidepressants, what was going on, I got answers like, well, I was having back pain and the doctor put me on the antidepressant, or I went in because I had diarrhea and the doctor put me on the antidepressant. And this just blew my mind, because what I was seeing was, once again, doctors were just listening to a symptom and using a psychiatric drug to treat that symptom. And yes, many of them said they were depressed and they received the drug for that. So I began asking them, well, how long were you depressed? What was going on in your life? And so some of the answers were things like, well, I've been depressed since my last child was born, or I've been depressed since I was a teenager. And I started looking at those kinds of things and realizing, you know, these people didn't have depression. They had real medical problems that were causing them to feel depressed. And once again, we wanted to find the underlying cause of those symptoms and fix them, so they didn't have a diagnosis of depression and they didn't have to take antidepressant medications. So that's when I started a book and wrote a book called Just Because You're Depressed Doesn't Mean You Have Depression. The definition by the Diagnostic and Statistical Manual of Depression is that basically you have these feelings of feeling depressed for at least 2 weeks. 2 weeks isn't very long. And if you've lost a loved one, you're going to feel sad for a lot longer than 2 weeks. Now, it doesn't mean you have depression. I see also people, like this happened when my dad died. The doctor asked my mom, you know, does she want to take a medication to help her with the loss? And my comment was, she's in mourning. She should be sad. That's normal. And we don't want to cover up those feelings that are perfectly normal. First of all, the sadness comes from how much we cared and loved that person. Why would we want to smother those feelings? I think you can mourn someone for years. It doesn't mean you have a mental problem. It means you love that person and you miss them. So I'm not an advocate at all of using psychiatric drugs, antidepressants, on someone who's in mourning, or who's maybe in mourning because they lost their job, or their house was flooded in a hurricane. People need support. They don't need drugs. And they need to understand those are normal feelings. If you've been devastated by anything, that's perfectly normal. And you know, the way we become who we are is living through issues that we don't always like. Life isn't just a piece of cake every day, but how we handle those things teaches us how to handle things again in the future, so the next time it won't be quite as hard on us. But if we cover up those symptoms with antidepressants, the next time we still don't have any tools. It's kind of like getting a cold, or a bacterial infection. If you throw an antibiotic at it, your body doesn't learn how to heal itself, and that's how we were made, to do that. So I think it's very important to have those feelings, to be supported in having those feelings, and not say those feelings are wrong and here you shouldn't feel those things, so cover them up. Psychiatrists went to medical school. They're DOs or MDs. They learned how to do physical exams. They learned how to do lab work. They did a residency in psychiatry, but why should that mean that they should ignore all their previous education in medicine and just say somebody has depression because they feel depressed, and not do the medical workup that they were taught to do, that everyone should do? Do they think that just because someone shows up in their office that they already need the psychiatrist and they don't need to look at the reasons why they're feeling badly? If that's the case, then the primary care doctor needs to be doing a more thorough job of doing the investigation before sending them to the psychiatrist. And in addition to doing the medical workup, the doctor should take the time to listen and find out what's going on in that patient's life. Have someone in the family lost their job? Has someone died that's precious to them? Has anything happened that would create the situation that they need emotional support for, not a drug? And that's equally as important as doing all the medical parts of this equation.